Now, our audience is in for a real treat today, as you, sir, have been the very center of so many momentous developments in the normalization of e-cigarettes as a tool for harm reduction, which is kind of the fancy clinical way of describing a tool to help smokers quit. So before we jump into the issues, please share with our viewers your background in harm reduction and expertise in tobacco control.
Well, I guess I started in harm reduction back in the early days of the AIDS crisis. I was involved in some early needle exchange schemes in the 1980s. And in the 1990s, I was involved in harm reduction around sexual health, especially with gay men's sexual health. And then I got involved in tobacco control in around about 2004, 5, 6. Before e-cigarettes had really come onto the market, before there was any presence. So when they did arrive, I was already familiar with some of the issues that we were going to encounter in harm reduction. And back in drug use and sexual health, it had been really very vicious, almost fratricidal. And I was determined that we were going to learn from that experience. We were going to have a much more mature dialogue between health professionals this time around, third time lucky.
So within public health, you were saying there was a great divide in terms of harm reduction, whether or not free needle exchange was a good thing and that sort of thing. Is that what you're talking about?
It was terribly controversial, and not surprisingly, because we really didn't know what was going to work. We knew we were in a crisis, that the house was on fire, but we didn't really know what was going to be the best way to put that fire out. So we experimented with needle exchanges and injecting rooms and prescribed heroin and all sorts of different things in different jurisdictions. And we kind of learned from each other. Some places, places that had a really strong abstinence-only ethos, they never really, or it took them a very long time to get on board with that.
So when you started in tobacco control, you were there right at the time that all of the real smoking bans started really happening. When was it in London that kicked in? I know that it was 2002, 2003 or so in the US and Canada that started really happening, and I think a little bit later in the UK.
Well, that's how I got involved. I'd been at Asthma UK, where I was head of policy. And obviously for people with asthma, clean air is a really important issue. I was still a smoker at the time, but I could see, regardless of my own behaviors, I could see that smoke-free public places made a lot of sense for other people's health. And so that's how I got involved, soon gave up smoking. Then around about 2007, when the legislation was passed, just before it came in, I joined ASH, Action on Smoking and Health. And then 6 months later, legislation came in across England.
Now, Martin, I think it's important to set the kind of stage for everybody. It's not talked about often enough to really hammer home the fact that up until just recently, in all three of our countries, US, Canada, and the UK, tobacco wasn't regulated until just recently.
I think that's true, and it's the product itself is regulated very, very lightly. We regulate how it's advertised, both in Canada and in the UK, and in the US to a degree. We have regulations about how it's packaged, but the product itself has very little regulation, which is surprising when you consider the very considerable hazard. I mean, it's not the packaging that kills people, it's the burning of tobacco.
But the nicotine, though, at least in the U.S., that's it's the drug that moved tobacco into FDA's purview. And of course, Health Canada's got that purview too as well, and the focus on nicotine. Is it different than in England than with PHE? Is PHE the regulator that actually does the regulations and the whole process?
Well, we have that function split with the Medicines Agency, MHRA, responsible for regulating nicotine products like nicotine replacement therapy, plus any e-cigarettes that got licensed as a medicine. But also, they're responsible for regulating other e-cigarettes. And that's where we draw the divide, because Public Health England is the authority with responsibility for regulating tobacco. So whether it's smoked tobacco or snuff or any of the other tobacco products, novel tobacco products, heated tobacco products, that all comes under Public Health England. That's where we do the split. So it's tobacco or it's nicotine. And that really changes the focus from the US, where they have to consider e-cigarettes as a tobacco product, even though there's no tobacco in them.
And how does that sit with you when you hear that?
I'm just glad that it doesn't apply in the UK, because it's a lot more straightforward. It's a lot more reflective of the reality to treat them as fundamentally different products. I mean, there's no tobacco, there's no smoke, there's no carbon monoxide, there's no tar, there's nicotine. But, and similarly in tobacco, there's no, we don't have propylene glycol or any of the kind of flavorings that we have in e-cigarette juice, but we just have nicotine. So it's really only the nicotine which they have in common.
Describe for us the UK approach to e-cigarettes and how and why it's in such stark contrast with other countries like Canada and the US.
Right from the outset, we wanted to maximize the opportunities that e-cigarettes present while we manage the risks. So we were never under any illusion that there are risks, and certainly there were risks that were very much unknown 5 years ago. But equally, we knew the huge scale of the opportunity. We have 6 million smokers in the UK, in England rather, 6 million smokers in England alone. And that's 220 deaths every day from smoking-related disease. That's a plane crash every day. So that's the scale of the opportunity, stopping those planes from crashing.
Martin, I'm going to describe for you just a little bit about the impression that vapers have and our audience has of Public Health England and what you all are doing there. You are like manna from heaven. Unbelievable. It's like, wow, there's a whole country that actually believes that vaping is not only could be a good thing, but is a good thing and actively promotes it to its citizens. Describe that for us. Communicate back for us how that approach is. What's the embrace?
If you're a smoker and you've not stopped smoking, try vaping. If you're a vapor, stop smoking. Okay, and that's a really important message. So we don't advocate dual use. We advocate smoking cessation. Stop smoking any way you can. And if that's with nicotine replacement therapy, great, go for it. If that's cold turkey, which is how I gave up, not once but a dozen times, then okay, there are more effective ways to do it, but if that's where you're going to do it, then okay, you'd think you might have done it already by now. But if you're not able to quit in other ways, definitely use an e-cigarette. And if you're vaping, stop smoking.
I want to take you back to the 95% less harmful research that you were talking about earlier, because it really is a lifeline. It's a battle cry for vapers, at least in North America. So in 2015, Public Health England released an evidence report stating that e-cigarettes are 95% less harmful than smoking, than normal cigarettes. Now, this was indeed a seminal report. Describe for us the evidence in the report, and what is the science behind the 95% less harmful determination?
What we actually said, I think, was that e-cigarettes are far less harmful, and that 95% less harmful is a good way of expressing that. The 95% less harmful, the 5% of the harm, that subsequently appeared in a Royal College of Physicians report. It first appeared in a report published in 2014 that was led by Professor David Nutt. And David had done this kind of study before where it was a kind of professional consensus process where you get a bunch of experts in the room. So we published in 2014. I guess we were doing the workshop in 2013. And we looked at what data we had, for example, on fires. We knew that smoking was the largest cause of domestic fires. There was little evidence that e-cigarettes were causing any domestic fires at all. We looked at what evidence we had about cancer risk and toxicant exposure, etc. And we had some data on that. And on the basis of the data we had, we looked at a range of products, including smokeless tobacco, different types of smokeless tobacco, e-cigarettes, nicotine replacement therapy, shisha, cigars, small cigars, cigarettes. We looked at the harm to the individual, and we looked at the harm to society, and we made an assessment on each of these criteria, both how much more harmful it was, and how important that harm was. And then the computer churns out a figure, and you see that the index is cigarette smoke, by far the most harmful. That gives 100 points, and then small cigars, and then e-cigarettes, which come in about 5% of the risk, and then nicotine replacement therapy, not 100% risk-free, because there's this small risk of, for people with heart conditions.
You've got the 5% of potential harm. How conservative is that? Like, if you were to go through everything today, would it be the same number?
Well, we published that study 5 years ago, and now we have 5 years more data. We have these excellent biomarker studies. We know much more about what's in e-cigarette vapor and how that might affect bystanders. Not at all is the shorthand for that one. And so, it would depend on the experts you got around the table. But I think looking at the data that we've got, it would be less than 5%. It would be substantially less than 5%.
Is it fair to say then, obviously, that Public Health England as an organization is totally behind this effort?
Oh, yes, absolutely. The idea to go for the 95% figure, put it front and center of our communications work, that was clearly agreed right from the top. My bosses, once they got it, once they understood it, they were completely committed. And, not just Public Health England, but, the UK ministers as well, right up to the then Cabinet Secretary and, then Prime Minister, very outspoken in favour of this kind of pragmatic English model of maximising the opportunities while we manage the risks. I'm very aware of the risk in this conversation where it's like it becomes how Martin Dockrell saved the world for vaping. And of course, I arrived in tobacco control when there were already a bunch of extremely sophisticated thinkers who had been doing really great work on tobacco harm reduction. They sat me down and patiently explained it to me. People like John Britton, Deborah Arnott, Martin Jarvis, Anne McNeil, Linda Bald. So I was definitely the new boy. But, they let me take part in these really great discussions where we would get people together to talk in confidence. And, the people who were in the room stayed part of the consensus, if not agreeing on all the conclusions about the science, because how could you? It was too early for everybody to be completely agreed on all the findings of the science back then. But agreed that we would have our disagreements respectfully and based on the data. And people who were not in that room, people who would not join us for those discussions, they continue not to be so much in that coalition, in that consensus. But if you look at the position of the British Medical Association, very similar to the position of Public Health England, the Royal College of Physicians, the Royal College of Physicians, they're the great thought leaders on this, but the Royal College of General Practitioners, the Royal College of Nurses, the Royal College of Midwives. Sure, we had people kind of maybe putting the emphasis on risk rather than opportunity, but at least we could have a kind of calm and sensible discussion with politicians about it, and they were persuaded by the science, and they were persuaded by our reading of the science and the huge opportunities that were presented. And I think so far, history is justifying their confidence. Back in 2014, it was not at all certain how this was going to pan out. 2016, not at all certain. By 2017, 2018, things looked like they were going pretty strongly in our direction. And And 2019, I think it's pretty uncontroversial to say smoking rates in England are falling very fast. And although e-cigarettes do not explain that in its entirety, e-cigarettes have a place in our comprehensive tobacco control. So we already have a tobacco advertising ban. We have high taxes making cigarettes not very affordable, increasingly unaffordable. We have standardized packaging. We have a ban on displays in shops. We have graphic picture warnings on the packs. We have all these measures, and into the mix we add e-cigarettes. So just at the time we're making smoking really, really unattractive, we're saying, but hey, look, there's this alternative that tastes fresh, tastes clean, doesn't give you any of the massive health risks, and people are voting with their feet. They're just giving up smoking in very large numbers.
Is it fair to say that e-cigarettes save lives?
It's indisputable, I think, that e-cigarettes save lives. They save lives because there are millions of smokers who are switching, and smoking will kill half of all lifelong users. You've got that data in front of you from the Roswell Park study, but also from the University College London study, finding very similar things. The toxicant exposure is way, way lower. We've got one of my slides has data from a study by Ed Stevens on carcinogens, and Ed Stevens finds that the carcinogenic exposure in e-cigarettes is 99.5% lower than in cigarette smoke.
Martin, I've got some data here that was released over the last couple of weeks, some kind of big news out of the UK, that the vast majority of e-cigarettes are used by ex-smokers and current smokers. And the data was over 3.2 million adults in Great Britain use e-cigarettes. So that's just over 6% of the adult population. And of these users, 52% are ex-smokers, 54% are smokers, and 4% are people who report never being smokers. And then the other thing here that's obviously astonishing is that clearly millions of British adults have made the switch.
We have a little over 2.5 million vapers in the UK. Just over 1 million of them are still smoking, and 1.5 million have completely stopped smoking. Now, of that 1 million who are smoking, about a third of them say that they are smoking, but they're trying to quit, and they're using their e-cigarette as part of a quit attempt. Now, interestingly, none of that includes the people who quit smoking and then quit vaping. So we have another, more than 1.5 million who have completely stopped vaping and smoking. So about 1.25 million who were former regular smokers and then tried vape for a while and no longer do either. And then we've got just under 500,000 who were regular vapers and had been regular smokers, and now they've quit both. And that's great. That's fine. If you're not taking any nicotine, great. I mean, I wouldn't advise vapers to come off their nicotine too quickly, because you don't want to relapse to smoking, because smoking is where all the harm comes. So, I always talk about my advice to my sister, who was a long time smoker, and she managed to give up when she was being treated for cancer. And when she went into remission, she started smoking again. And she said to me, "Well, Martin, I've got one of these e-cigarettes, and it's high nicotine, but as quick as I can, I'm going to go down to medium nicotine, low nicotine, zero nicotine, then I'm going to come off completely." And I said, "Don't you dare. Take it slowly, because the last thing you want to do is come off the nicotine so fast that you go back to smoking." And so it took her a few years, and she said to me, "Look at me, Martin, zero nic." And that's great. She's on zero nic now, and she's happy about that, and so I'm happy for her. But most of all, I'm happy, and she's happy, that she's not smoking anymore.
Well, that's great news. The fact is that the discussion about adults almost seems to never happen anymore. Definitely in North America, it's always about the kids. An example I use, acting FDA Commissioner Sharpless came out with their moving forward on e-cigarettes. This is like about 2 weeks ago. And when you read the statement, children and teens and kids are used like over 30 times, and there's only 4 mentions of adults.
So there's a really interesting thing, because they're not even looking at most of the kids who are using e-cigarettes. And they've focused their attention very, very specifically on kids who have never smoked and who have tried e-cigarettes. So all the gateway studies that we see coming from the US and in the UK and Canada, the first thing they do is eliminate any of the kids who have ever smoked. Well, okay, if you're trying to look for that kind of gateway process, that makes sense. But what you're doing is you're eliminating the vast majority of kids who've used e-cigarettes, right? Because the more you smoke, the more likely you are to vape. So by rejecting that, they're immediately failing to explain most youth e-cigarette use. So then they find this effect, and they suggest that it looks like there's I have to say, relatively small effect on a very small number of kids, increasing their likelihood of starting to smoke. Right, so that would be one factor. But we also know that one of the biggest drivers of youth smoking always has been the behavior of adults around them. Does mum and dad smoke? Does your big brother smoke? Uncles and aunts. And the more you can reduce those adult role models for smoking, the more you're going to reduce youth uptake. If, as we are in England, we help smokers to quit by switching to vaping, they're no longer smoking role models. And so, this on-ramp, off-ramp argument becomes a lot more complex. So, for example, all these kids who are smokers who subsequently start vaping and then stop smoking, I'm not going to advocate that, and I'm not going to claim that there's a causal effect. But if you're going to look at one side of the equation, you have to look at the other side of the equation too. If you're looking at the possibility that e-cigarettes might initiate smoking uptake, then it's important to look at the possibility that e-cigarettes might help smoking cessation.
Martin, one of the things that's very frustrating when we hear it, it's 2019, and we keep hearing that more people believe vaping is as harmful or even more harmful than smoking. And that number keeps growing.
Well, this is something we've been looking at for a while because we were aware that, the first data from this came with doctors. We knew that they tended to have an inflated belief that nicotine was the source of much of the harm from smoking. And so it was important when we were trying to get them to prescribe nicotine replacement therapy that we challenge that false belief. We see more and more people believing that e-cigarettes are at least as harmful. And we know that's not the truth. So there's been some really good studies that look at what we call biomarkers. So they look at the physical signs in the body of harm, and we compare smokers, people who only smoke and don't vape, with people who vape but don't smoke. And we have data from people who both vape and smoke. And we have data from people who neither vape nor smoke. And these are both UK studies and American studies, studies from Roswell Park. And they find consistently that, vaping isn't some kind of magic potion. If you're a smoker, it doesn't make the harm disappear. But if you stop smoking, even if you continue vaping, the harm falls dramatically. So we looked at the researchers, way clever than me, looked at a whole range of the signs, the chemicals in the body that would indicate your risk of harm for either cancer or heart disease or respiratory disease, and consistently find that compared to smoking, people who switch completely to vaping have much lower levels, and levels broadly similar to people who neither vape nor smoke.
So when we look at the millions of people in the UK and in England specifically that have actually quit smoking using vaping, so then is it fair to say, can we draw the conclusion that e-cigarettes are an effective tool to help smokers quit?
Well, they're two separate things. One is, do they help smokers to quit? Well, yes, they do, but interestingly not, it seems, equally everywhere. And the next question is, are they less harmful? And that's certainly the case. That's the same everywhere. It's the same in the US or the UK. If you switch completely from smoking to vaping, then you substantially reduce your risk of harm. Now, the reason things differ in terms of how effective they are in quitting is that a lot depends on whether a vapor thinks it's worth making the complete switch. And so if a vapor or a smoker believes that vaping is just as harmful, well, why would they switch? Vapors who understand that vaping is much less harmful are much more likely to switch completely, are much more likely to stop smoking. So paradoxically, my public health colleagues who think they can scare people out of vaping, what they're doing is they're scaring people out of switching. They're scaring people into smoking.
Yeah, sometimes it seems, well, sometimes they've said it, they'd rather have people stay smoking than make the switch.
Yeah, well, all sorts of crazy things get said from time to time. That's probably right up there with the craziest. There is just no circumstance, whatever, where a smoker would be better carrying on smoking. Just switch. It's, there's no circumstances whatever where you'd better carry on smoking. Anybody who tells you otherwise is lying to you.
What's going on with the hospitals and the vape shops? I mean, my audience wants to know about that.
In England, we are kind of declaring our National Health Service smoke-free. So we know for a long time we've not allowed people to smoke inside the hospitals, and now we're not allowing people to smoke in the grounds either. But a smoke-free hospital isn't one that makes smokers stand in the street. A smoke-free hospital is one that helps smokers to quit. And so now as well, we're making it pretty much mandatory for hospitals to ask everybody if they smoke. And if they say yes, offer them help to quit on just an industrial scale. Now, we know that switching to vaping is a very easy way for people to quit, sometimes permanently and sometimes just to get through the period when they're in the hospital. And that nicotine replacement therapy often doesn't cut it for these heavily addicted smokers. So we don't have any licensed e-cigarettes as medicines yet, so doctors can't write a prescription for an e-cigarette, but they can stock them in the shop, in the hospital shop, and people can buy them and use them there. So why not?
Martin, with all of the research that comes out of the UK and England, all of the great programs that Public Health England is implementing, what's going on over there? Is it something in the tea?
Well, it's not unique to the UK either. So it's certainly not unique to England. But if you look at New Zealand, they had a very similar policy to Australia, where they had banned e-cigarettes unless they were licensed as medicines, and none were licensed as medicines. So they've changed their mind completely, and now they have this amazing Facts About Vaping website, which I strongly recommend to your viewers. But Canada also had a ban, and Canada's laws are certainly more liberal than they were a while ago. France as well, Public Health France are also recognizing the value of e-cigarettes, the opportunity to help smokers to quit.
What about the US?
I think in the US it's all to play for. I think there are millions of vapors in the US who I really, really, really don't want going back to smoking. I mean, that would just be a tragedy. And so I've skin in that game as well. I was born a US citizen, and although I work for the British government, I don't want my American cousins relapsing to smoking. I just, it'll be a tragedy, and that's no way to win this experiment. For it to be at the cost of millions of American lives, that would be a tragedy. I don't want to win the argument that way.
Is the potential as bleak as it's being depicted?
Well, look, with the European Tobacco Products Directive, some people argued that it would take 90% of e-cigarettes off the market. It took very few e-cigarettes off the market. My fear is that if e-cigarettes are effectively removed from the market, then there are millions of ex-smokers now who will have to make a choice. And I'm hoping most of them will choose just to stop the nicotine completely. I'm fairly certain some of them at least are going to relapse to smoking. And a whole bunch of smokers who might otherwise have quit never will, and they'll die, and that will be a tragedy.